Good. Well, we're going to get started. We want to welcome everyone, whether you're listening to us live or listening to the recording. I am Mim Sempt, co-founder and CEO of Motivity Care. We are delighted to have you with us today. Today, we're going to be talking about all things healthcare directives. And our expert speaker is attorney James or Jim Ruggiero. He's the managing partner at Ruggiero Law Offices. He has more than 30 years of experience practicing law in Pennsylvania, and they are licensed in multiple other states. He founded the Ruggiero Law Firm's offices in 1990, offering personalized guidance in areas of estate planning, estate administration, elder law, business law, and real estate. He has been named a top attorney in trust and estate and elder law in Mainline Today magazine. If you're in the Philadelphia area, I'm sure you're aware of that magazine. And he has received the five-star Wealth Manager Best in Client Satisfaction Award 5 years in a row. So thank you so much for being with us today, Jim, and sharing your expertise and hopefully making us a whole lot smarter about healthcare directives.
Well, ma'am, thanks for having me on today. Really appreciate the opportunity to meet and talk with everyone today and help give hopefully a little bit of insight into why we want to make sure we've got our advanced healthcare directives in place.
Great. So let's start with the basics. What is a healthcare directive?
So, simply stated, a healthcare directive is your written instructions about how you want to be treated in certain, events. If you're incapacitated, you need someone to make healthcare decisions. So in Pennsylvania, we use the term healthcare agent. So you can designate in advance who you want to take care of you if you can't communicate your healthcare wishes to your doctor. We have this in all states. There's healthcare surrogate, healthcare agent, attorney in fact, different titles. But what is it? I want to make sure that my loved ones can help me in the event of a healthcare emergency when I can't help myself. So we call it taming, the healthcare process that's out there. It's wild. There's so much involved. So there are a number of documents that you can have. That's why we call them advanced directives, because you do them in preparation of any events. You want to have things in place when you don't need them. It's doing fire prevention versus putting out the fire. So by putting advanced directives in place, you have to sometimes talk about some difficult decisions. Number one, what happens at the end of my life? Those things you hear all the time called living wills, those are written instructions. How do I want to be treated when I'm about to die? So it's a tough job. We have to talk about incapacity and death when we're talking about advanced planning with healthcare, because no one wants to think about themselves being incapacitated. No one wants to have to think about themselves at the end of life in hospice, in a hospital, on their deathbed, and having a loved one have to give the instructions to the doctor: stop the machines, take them off life support, don't artificially prolong the dying process. But the key is you make decisions in advance about who do you trust? Who do you want to make decisions for you if you can't make them for yourself? And so all of those terms we used, they're a synonym for advocate. So I'm an advocate for making sure that people that we encounter have the tools in the toolbox in the event of an emergency. So there are a number of advanced healthcare directives that you can put in place in any state.
Yeah, so let me jump in here for a second because I think, you're right. It's very difficult for people to think about, talk about end of life, right? It's scary for a lot of people. But I think it's also important to understand that this isn't just about end of life. It
Correct.
could be an accident. I personally went through this with my own husband who was in a hit and run accident. So when we talk about healthcare directives, I think it's important to understand that, you could be going through some kind of medical procedure and suddenly have some complications and somebody else has to make decisions for you. And so it doesn't always mean end of life, but it's this protection, as you pointed out, that you're putting in place. And I think the other thing is, I think you touched on this. Your loved ones that may already be stressed in that situation know what you want. your wishes are being carried out. And so there is a level of reducing the stress in your family in those kinds of situations that just make having these things in place so important. And I know that you've touched on that there are, I think people say, well, is there one kind of healthcare directive? Just like, is there one kind of trust? And so it'd be great. I know you've talked to us about like, what types of healthcare directives are there and what are some of the things that need to be in there for them to really do what they're supposed to do?
So it's very important. I did jump into the end, but let's start at the beginning. So let's start, and there's three documents that I recommend for all individuals to have. Number one is your own family HIPAA release. And this is for any adult. You can designate in advance people that you trust to be, you know, the recipients of your protected healthcare information. So it's really important. You talk about healthcare emergencies. This is why I have this in place. I got a call from my daughter who went to college in South Carolina. We live in Pennsylvania. Dad, my phone's about to die. I'm in the emergency room and they're going to give me a brain scan. That was what she told us. My
Mm.
wife had to get on a plane 6 a.m. that morning and fly to South Carolina. But because we are planners in advance, our daughter had signed a HIPAA release before she went off to college because she was over 18 and an adult. And she had a healthcare power of attorney in place as well as a living will so that my wife could be her advocate and just talk to the doctor. What's going on with my daughter? Every time we go to a hospital system, they tell us to have a HIPAA policy. We sign here, acknowledge that we have a HIPAA policy. Our family HIPAA policy is, ma'am, your husband has given you permission to, talk to his doctors and find out what's going on. You don't have to be incapacitated to have that in place. You need a second set of ears. A HIPAA, release is a tool. For my mom and dad, we used to call it Doctor Day. One Monday a month, it was Doctor Day. Later in life, we were driving them to the doctor. So not only were we driving, we were sitting in the meeting, listening to what the doctor had to say, because you know what it's like when your parents come home from the doctor. They say, "How is everything?" "Fine." Okay. Beth, my wife, went with my dad. What did the
Don't want
doctor
to worry
say?
you. Don't want to worry my kids,
Right.
right?
He needs to do A, B, and C. He never mentioned it. So a HIPAA release is a really important tool that you have and prepared in advance. So the other ones, you've got to be in an accident. You've got to be incapacitated. You've got to be at the end of life if it's your living will. But a living will only covers a very narrow set of circumstances. More importantly, is a healthcare power of attorney, where you designate a decision maker when you can no longer communicate your decisions to your doctor. And that's determined by your doctor. So that's why we say there's three that you need to have. It's really important. And one last family story, because I have way too many personal stories, not stories as a lawyer. I was my father's healthcare agent. He was in hospital for 10 days. 9 days, every morning the doctor would come in and say, "Jim Sr., how you doing?" "Good. Make me better, doc." 10th day, he couldn't respond. For that one day, I was his healthcare agent.
Right.
He couldn't communicate to the doctor. And that day he passed. So I didn't have a lot to do, but you just never know. But the importance of a healthcare agent is they can negotiate with doctors and hospitals,
And
get
I think
second opinions.
Right. And I think, we're talking with this within the framework of what we think of as a traditional family, but there are solo agers. There are people that may not have people close to them, or may not even have family close to them. And so thinking through who is that person, right? And you may have a blended family, or, family may not be blood relatives, depending on how you look at that. And so again, this putting these things in place makes sure that the person you want doesn't have to be a family member.
And when you're talking about an advocate, lots of times it shouldn't be a family member because they're not able to be an advocate because of various reasons. It's your friend, it's the trusted professional that you've come to work with that out there, such as people at Nativity Care are able to put people together with geriatric care managers, people who actually serve as professional healthcare agents. There's a growing rise of professional healthcare agents because of a growing need for professional healthcare agents in the country today. We don't have enough people to take care of our aging population. People don't have enough family to take care of them. And lots of people are solo agers, don't have children, are not married. So it is about naming the right advocate. This is why you do this before a crisis breaks out. You take the time to work with people that you trust. You get referrals from someone like Nativity Care because you work with the best people in the areas that you are, involved in. And we're attorneys, but we talk about the whole life care plan. That just, there's 10 things that you have to take care of, and your legal documents are just one of them. There's so
Right.
many other things, but it's a really important piece of the puzzle, knowing who's going to be your advocate if there's a healthcare emergency. We often ask our family, well, I love my kids, but they live in California. I said, well, who's going to drive you to the doctor and bring you home after you finally get that colonoscopy done that you're supposed to get every 5 years? That's oftentimes the person that should be your healthcare agent, the local person. And again, it's not family, it's an advocate that you trust because you do invest a healthcare agent with the ability to make life or death decisions.
Right. So I think it's important to point out or discuss a little bit. So what if I don't have one? What happens?
So the law varies state by state. I will give you an example. In Pennsylvania, the law is as clear as mud, but what everyone should understand is if you don't make your own decisions and put something in writing, the state or the hospital will have a plan for you. What do I mean by that? In Pennsylvania, if you don't designate a healthcare agent, they will go look to your family tree. Are you married? Then it'll go to your spouse. If you're no spouse, do you have children? It'll go to your children. Well, what if you have children from a prior marriage and are married to a second spouse? Well, guess what? They each have a vote, which causes gridlock. So all of a sudden, your children from a prior marriage can be fighting with your current spouse over treatment decisions. And then that leads to the requirement of a court ordered guardianship over the individual who didn't do a good job in decision making in advance. Lots of times we get calls from hospitals telling us that there's no decision maker for an individual. So the hospital is going to seek to have someone appointed as the emergency guardian to make healthcare decisions for that individual in a hospital that needs to move out to skilled care, needs more services, needs to get rehab, needs to go to a skilled nursing facility, and they're unable to participate in the process. And if there's no directive in place, a court has to assign a guardian to make those decisions. And then you lose control over your whole life
Right.
because a court has said this person makes all my healthcare decisions.
Right. And that guardian may not know you, your family, your wishes. And so again, to your point, if you want to be in charge of the decisions that get made, you have to have something legally in place. And I think too that, revisiting this because lives change, right? To your point, maybe you've been married, maybe somebody goes through a divorce, blended families. Again, that's why, getting credible, ethical advice and making sure that everybody is very clear about who has the right to make those decisions for you is an incredible gift in my mind to your family because you do get to this point of like infighting and nobody wants to think that their family is going to do this, but you don't know what their views are on treatment. And
That's really important, man, because lots of times people have different beliefs and different belief systems within a family. So we oftentimes hear, I can't have my son be my healthcare decision maker because he won't follow my wishes. And you may wish to not have blood products transfused into your body because of a religious belief. And that is something that matters to you, very much so. Lots of times we craft healthcare directives based on your specific religious beliefs so that we comply with our clients' wishes. And someone who's not um, part of that faith may say, well, that's silly, or that doesn't make sense from a rational basis. But, I totally disagree. This is all about you controlling outcomes, you making sure that you tame the process, you have it go the way that you want to. We all have the ability to accept or reject healthcare at any time. We don't have to accept the doctor's advice. We can choose not to have surgery. We can choose not to go do chemo or radiation for palliative care because it's not going to cure me or make me better. And I can say, I don't want this. And then if I'm incapacitated, my agent can say, He didn't want this. So continue to just keep someone comfortable and pain free if we're at that point in life.
Well, and I'll give you a very specific, this is a family example. So we had a family member that had ALS and Lou Gehrig's disease, if anybody knows, and it is a devastating disease. It really is. But there are places, now this was not in the United States, but it's a very clear example of why. So she was put on a respirator, and the law in that country said once you're on it, you can never come off. There is no choice in the matter. And this seems like a dramatic example, but I think that you talking through that with yourself and your family in a situation like that, I also think that it's interesting to think about, look, I may have a different view of things at 55, 60 than I do at 85 because I can tell you flat out that my mom has been very clear at her age. She's getting close to 90 and her wishes, which we have in writing, very clearly states, I do not want to go through chemotherapy. I do not want major surgery. And that's her choice. And so we have it in writing. We will honor that. But again, if you're 55 or 60, that may not be the choices that that you want to have out there. But I think it's that's why it's not necessarily a once and done thing. Life changes, life circumstances changes, your views may change, and so you can always go back and revisit, which I think is again really important about nudging people about these things, right? Um,
Yes, it evolves, as you pointed out. What I think at 55 versus 80, it's about controlling the process. It's about death with dignity. It's about knowing that not only do I have my legal documents in place, I may need to have an advanced directive from my doctor called a physician's order for life sustaining treatment or an out of hospital do not resuscitate order. Those are medical directives so that if I'm 85 in a skilled nursing facility or an assisted living facility, I need to have that pulsed on file. So if I code, they don't revive me. I had a client where they lost her directives. And so CPR, when you're 92, cracks your ribs, puts you on, life support for 6 weeks instead of having death with dignity. It's about taming the process. The job of, physicians, nurses, hospitals is to keep us alive. It doesn't mean they can always make us better. So that's a key piece that I think everyone needs to understand. They can keep the body alive long after the soul has left it, in my opinion. All right. It's about knowing that it's hard to say goodbye, but we don't want to prolong it just because we have electricity. If there was no electricity and I would be gone, then let me go. And it can seem rather simplistic, but think about it. You know, I don't want to be the ghost in the machine. I don't want to have my consciousness downloaded. I don't want my body to, be, kept alive on a vent because the machine can keep me breathing when I have ALS and I can't do it on my own. And it's very important because we've had clients who have said no vent when they have ALS, and we've been there when they've made that decision, and then they have death with dignity, but they don't have to go to that next level of care. And it's a hard decision, but I've had a few clients do this. And you know what? It was their best decision. It was their choice. And their families honored their wishes, their doctors honored their wishes, their caregivers honored their wishes. And it's about, you know, courage and being brave because they made those decisions to say no. Just don't do this because you can. Just because you can do something doesn't mean you should do something.
Right. And I think you and I mean, for any of us that have been directly involved with all this caregiving, I really appreciate this death with dignity and that you having that choice. It is a hard discussion. It is a hard thing for us to talk about or think about. But I also believe personally that it actually gives you more freedom because instead of pushing something off or not thinking about it, the decision is made. It's okay. Everybody knows what they need to do. And it allows for space in those most precious moments where I've seen, and I'm sure you have too, people having real conversations, meaningful moments instead of running around and fighting over things. It just adds a level of peace of mind and care for everybody involved in that process, not just for the person that's made the decision, but family members, friends, whoever's obviously involved. One other thing that I know that you have a special expertise in, and I wanted to bring this up, is also for special needs adult children, which is kind of a whole nother challenge for families that, are dealing with that. So I'd love for you to talk just a little bit about the approach for someone like that or is thinking about that for their adult child.
So, Bim, as you referenced, in my own family, we've had family members with physical disabilities and mental disabilities, cousin with Down syndrome. We have less families members with Down syndrome these days, but we have a huge rise in family members with autism. And so when you talk about where an adult child is, we just don't know when a 5-year-old is diagnosed with autism what they're going to be like when they're 25. And when we get to that point in time when they're out of school, there's no more help. You have to look at what are we doing in the way of planning. And lots of times it's important to become a guardian for a severely autistic adult because they can't make their own decisions. Lots of times it's important to just put the supports in place for people who we want to live in the community with help to have documents in place for that adult autistic child, but also leaving a loving legacy. Everyone asks, why do we do all this planning? It's because you love your family. That's the only reason to do it. If you don't love anybody, you don't care about anything, don't do it. But love yourself. But we want to put supplemental needs trusts in place. We want to create accounts. We want to create plans to use family members and nonprofits and caregiving. Things evolve over time. We want to make sure there's enough money to take care of your loved ones. That means using professionals to plan financially, perhaps purchase life insurance to fund a trust. That's a whole nother half-hour discussion at a fireside chat to talk about adult and family members with special needs because everybody is special. Some are more special than others and need more care and attention from their parents, from their grandparents. Again, it's about guardrails, guidelines, protection. Sometimes I sound like the chief safety officer at a company.
Reduce the risks, right? And have control.
Sorry, yes. I use the term risk management, but really it's about protecting those we love. And you know what they say, when you're the pilot and the plane's going down, you need to put the oxygen mask on first. So you have to take care of yourself. And you talked about one really important thing. I know we're getting to the end. It's about having the moments of joy with the people that we love at the end of their lives. It's not about worrying about the fight over tube feeding, no tube feeding, surgery, no surgery, where are you going to stay, who's going to take care of you. It's about having the ability to reflect on all of the memories that you have in life. I was blessed to go to the theater with dear friends last night, and he's 88 years old, born 1937, just like my mother. My mother died over 10 years ago. I can't have those conversations with my mom that I would love to have today in person. I was able to have a great conversation with Larry and his wife Lynn as we went to the theater. And it just made me sad and happy at the same time that I could still do that. But I had these conversations with my parents about putting decisions in place in advance, having the agents in place so that when there was time to have things occur, that wasn't, the crisis.
Right.
And this is why Motivity Care provides such an important service because our kids don't live a block away. All right. Nobody lives around the corner from, their whole family anymore. There's a diaspora. Everyone's out there. I'm not relying on my adult children who I love to take care of me when I'm older because they're not going to be next door. So this is why we have to have professionals assist us because it just makes sense.
Yeah, I could not agree more like you. I have been through this multiple times with my own family members, and it is with some that did not have things in place and with those that do. And you are 100% right. And it's why Motivity Care partners with um, law firms and you specifically and your team because you have the expertise, but you also have the compassion and ethical bar that I think is required. And from our perspective, that
Thank
is
you.
Doesn't matter whether it is food service, transportation, legal advice, medical advice, whatever it is. Too often we will get a referral, but there is no real vetting process behind this. And you get yourself into, so not only are you in a caregiving situation that is, taking away from your career, your own family life, your personal life, whatever it is, you may find yourself in a position where you put them in the wrong home. You don't have the right legal things in place, and it becomes even more hell. I
Practical
agree.
common sense advice from the team is what matters. The team
Right.
at
It's a
Motivity Care.
team of vetted, ethical, compassionate, experienced professionals that make sure that whatever is put in place is really aligned with your wishes, your budget, your vision for what, you want to have. And frankly, I mean, the sooner the better, right? When is the right time to do this? Now.
Yesterday. Yesterday.
Yeah, I would agree with that, Jim. Right? Yesterday, if you don't have this, maybe you should be thinking about it. And again, that first phone call, make it, get the information you need, put those things in place because you are 100% right. Those, if you can take the administrative burden away from a very profound experience when you go through anything like this, it gives you the space to have conversations that will be so precious and mean so much for you long after that person has left. It is about giving you back that time and the space for that kind of caring conversation. It is invaluable for anybody that's been through it. If you have, you already know. And you haven't, give us a call. Let us, at least give you some basic guidance so that hopefully it'll give you more peace of mind. We
Let
are
me
at
reiterate the call to action for everyone is to call MIM and Motivity Care, get a referral to a good local estate planner who understands working with elderly clients so that you have those documents in place in the event of an emergency. How about you have them in place when it's not an emergency so that they're on file? So when you need them, they're there. By the way, we hope you never need the documents, but we want them to be there.
Right. 100%. Look, the reality is that almost all of us are going to make care decisions for someone we love, or somebody's making them for us. When you got a plan, it makes for a much better.
Plan, failing to plan is planning to fail. I learned that a long time ago, right?
Absolutely. Well, Jim, we would like to invite you back to talk a little bit deeper dive into special needs adult children. I think it's a topic that a lot of people would really benefit from. Thank you so much for your expertise, your willingness to share your knowledge with us. And we look forward to having you on again. And we want to
Thank you.
thank everybody who's joined us or listening to the recording. And we're really excited because next month we will be having Dr. Gerda Mazel, who is not just a doctor, but was a hospital administrator. She is an expert in understanding how to navigate transitioning from a hospital to home to reduce health risks and get all of those things aligned. It can be a very difficult process. That's going to be on Thursday, May 15th. As always, our webinars are free. We're here to educate and help people have more peace of mind. And we invite you to speak with us. And we are here to help and answer your questions in any way we can. So thank you, Jim. We hope everybody has a great rest of their day.
Thanks, Bim. Everyone have a great day and a great weekend and be well and think spring. Bye now.